Assalamualaikum and hello everyone. Welcome to our presentation on a critical health issue affecting many families in Malaysia, infertility. Infertility is a topic that is often shrouded in silence and stigma, yet it affects a significant portion of our population. Today, we aim to shed light on this issue, providing you with a comprehensive understanding of its causes, impacts, and the available treatments. We hope to foster greater awareness and empathy, encouraging a more supportive environment for those experiencing infertility. My name is Alia Natasha, and I am joined today by my incredible group mates Regina Kaisara, Yasmin Alisa, and Ainul Mardia, who will be sharing valuable insights and research findings with us today. Malaysia has seen a notable decline in its birth rate, posing significant demographic challenges. A major factor in this trend is infertility, particularly male infertility. The government reports that 60% of sperm analysis tests show abnormal results, directly affecting fertility rates among couples. This decline in fertility affects not only individual families but also broader socio-economic implications such as an aging population, reduced workforce, and increased strain on social services. It is essential for us to address and mitigate infertility issues in Malaysia to reverse the declining birth rate and ensure a healthier population. Let's examine the birth rate trend in Malaysia from 2004 to 2024 as illustrated by the first graph. In 2004, the birth rate was around 19 births per thousand people, and by 2014, this rate had decreased to approximately 17 births per thousand people. And looking at 2024, it is projected to fall further to about 14 births per thousand people. This consistent decline in birth rate could be closely related to increasing infertility rates in Malaysia. As more couples face challenge with conceiving, the overall number of births per thousand people continues to drop. This trend highlights a significant demographic change pointing to potential long-term impact on the population structure.
Next, let us look at the factors that contribute to infertility issues. What are the factors that affect fertility for both male and female? For men, three factors can contribute to infertility, which is erectile dysfunction, ejaculation issue, and infection. First of all, what is erectile dysfunction? Erectile dysfunction is the inability to get and keep an erection firm enough for sex. It does not directly cause infertility. However, conditions that cause the former may increase the risk of infertility. For example, a person with anatomical differences may have low sperm count and difficulty sustaining an erection. A minor physical condition like heart disease, obesity, and smoking can cause erectile dysfunction as it can slow the sexual response that might cause in maintaining an erection. Next factor is ejaculation issues, which is retrograde ejaculation. Retrograde ejaculation occurs when semen enters the bladder during orgasm instead of emerging out the tip of the penis. Although it still can reach the sexual climax, it might ejaculate very little or no semen. This is called a dry orgasm. Various health conditions can cause retrograde ejaculation, including diabetes, spinal injuries, medications, and surgery of the bladder, prostate, or urethra. Thus, retrograde ejaculation is not harmful, but it can cause male infertility. Last but not least is infection. Some infections can interfere with sperm production or sperm health or can cause scarring that blocks the passage of sperm. These include inflammation of the epididymis or testicles and some sexually transmitted infections due to promiscuous sex, including gonorrhea or HIV. Now, let's look at the factor that can lead to infertility in women, which is ovulation disorder. Ovulation disorder are a common cause of infertility in women because during a normal menstrual cycle, the endocrine system prepares the body for pregnancy by secreting hormones like gonadotropin-releasing hormone, follicle-stimulating hormone, and luteinizing hormone. Some medication, condition, and lifestyle factors such as being overweight or underweight affect the hormone levels and can cause irregular hormone production or damage the ovaries, resulting in an ovulation disorder. Aside from that, there is another element that contributes to infertility produced by these two genders, which is hormonal imbalance. Hormonal imbalance occurs when the human body has too much or too little in production of a hormone that is important for regulating bodily processes. For example, disorders like polycystic ovary syndrome (PCOS) and anovulation can be the result of a hormone imbalance in women. Men may also experience hormonal disorders that affect their fertility, such as low testosterone levels. An absent or irregular quantity of one or more hormones can delay or prevent any of the above processes from occurring, making pregnancy difficult to achieve.
The treatment that our group has chosen to overcome the infertility problem among men is intracytoplasmic sperm injection, or ICSI. Let's learn further about this treatment. Firstly, what is ICSI? ICSI is an infertility treatment. It involves injecting live sperm into a person's egg in a laboratory. This procedure can create an embryo. Moreover, it is a form of in vitro fertilization, IVF. ICSI promotes fertilization through the direct injection of a single sperm into a single egg. Still, it doesn't guarantee fertilization. In both ICSI and IVF, the healthcare provider implants the fertilized egg into uterus. Pregnancy will occur if the embryo attached to the lining of the uterus. Let us learn the procedures. During ICSI, firstly, the healthcare provider will use a pipette, which is a small glass tube with a suction bulb to hold the mature egg in place on the left dish. Secondly, they will immobilize and pick up one sperm using a thin needle. Thirdly, they will insert the needle into the egg to reach the cytoplasm. And finally, they will inject the sperm into the cytoplasm and withdraw the needle from the egg. To be more clear, let us see a short video on how ICSI works. Now, let's hear the Quran verse regarding ICSI.
وزكريا إذ نادى ربه رب لا تذرني فردا وأنت خير الوارثين فاستجبنا له ووهبنا له يحيى وأصلحنا له زوجه إنهم كانوا يسارعون في الخيرات ويدعوننا رغبا ورهبا وكانوا لنا خاشعين.
From Surah Al-Anbiya, verse 89 to 90, Islam encouraged procreation, which depicts the prayer of the Prophet Zakaria asking for an heir, showing how he is supportive of his infertile wife. As seeking treatment for any illness is allowed and commendable in Islam, it is also applicable to seek treatment for infertility. Many Muslim countries, including Malaysia, allow fertility treatment such as ICSI within the marriage, and guidelines to facilitate this process with Sharia have been issued. The first fatwa is from the 5th Muzakarah of the Fatwa Committee and National Council of Islamic Religious Affairs Malaysia, 16 to 17 November 1982. This conference focused on the in vitro fertilization, IVF. As ICSI is a type of IVF, the fatwa is applicable to this treatment too. The committee decided that babies from ovum of wife and sperm of a husband, which have been mixed using respectable methods that are not contrary to Islam, is valid, harus or halal. Furthermore, a baby born through test tube method can be a guardian and is entitled to receive inheritance from rightful family. This is different from adoption, as the adopted children could not inherit from their adopted family. Lastly, if eggs fertilized using ICSI or IVF method are not from a married couple, then the procedure is invalid, haram. The second fatwa came from the 18th Muzakarah of the Fatwa Committee and National Council of Islamic Religion Affairs Malaysia on 1st to 3rd of February 2008. This conference specifically discussed about surrogacy, where they decided that surrogacy is forbidden, haram in Islam, even if sperm and ovum were taken from a married couple. This is due to the risk of genetic confusion to the unborn baby. In conclusion to these two fatwas, they indicate that fertility treatment such as intracytoplasmic sperm injection (ICSI) is permissible as long as it is within the confines of marriage and does not involve any third party. There are voluminous amount of ways to increase fertility among Malaysians. Firstly, individuals should prioritize omega-3 fatty acids. These fatty acids support fertility by improving hormonal balance, oocyte quality, embryo implantation, menstrual cycle, and sperm health. Not only that, omega-3 fatty acids also mitigate inflammation, as this inflammation could interfere with proper function of reproductive organ. Another way to increase fertility is by minimizing refined carbs. Speaking of carbs, it's not just the amount of carbs that have an impact, but also the type. Everyone may want to pay particular attention to refined carbs that can be found in processed grains such as bread, pretzels, noodles, muffin, and others. Why should individuals minimize this type of carb? Firstly, refined carbs absorbed by the body very quickly, causing the blood sugar and insulin level to spike up. This type of carb also has high glycemic index. Glycemic index tells people whether a carbohydrate-dense food will raise your blood significantly. To relate the increased amount of insulin with its effect to fertility, it is studied that insulin is chemically similar to ovarian hormone, which is the hormone that helps eggs to mature. Consistently increased amount of insulin cause body to produce fewer reproductive hormones because it thinks the egg doesn't need it anymore. This will contribute to lack of egg maturation and ovulation, which also results in infertility on the individual. Thus, it is important to lessen the risk of infertility by minimizing the intake of refined carbs. Next, it is known that exercise has many health benefits, and one of them is increased fertility. Increasing moderate physical activity has positive effects on both female and male fertility, especially for those with obesity. Exercise can affect fertility because exercise has effects on multiple reproductive hormones. These include estrogen, progesterone, and testosterone, as well as hormones like cortisol and insulin. These all influence ovulation, the release of an egg, and generally improve pregnancy rates and outcomes. It is recommended to do at least 60 minutes of moderate exercise each week. This can be achieved with walking, swimming, and exercise class, dancing, or yard work. The key is to find exercise that you enjoy so you are motivated to continue it. If you have more intense workouts already in place, it is usually okay to continue them on.
In conclusion, infertility, whether in males or females, can be challenging to navigate emotionally and medically. It often requires a thorough assessment of both partners, lifestyle adjustment, and sometimes medical interventions. Seeking support from healthcare professionals and loved ones can be crucial in managing the journey towards parenthood. Moreover, infertility is a complex issue that affects many couples worldwide. It is essential to approach it with patience, understanding, and a willingness to explore various options. While it can be a difficult journey, advancement in reproductive medicine offers hope for many couples seeking to build their families.
For this assignment, we selected a range of references including peer-reviewed articles, authoritative journals, and credible online sources. Each reference was chosen for its relevance and reliability to ensure our research is accurate and comprehensive.